So diet and exercise can also affect women's health. Some factors that you can change in order to make you like healthier and your diet better would be oral health. Gum disease is more preventable in women and is connected to cardiovascular disease, diabetes, osteoporosis, respiratory illness, and eating disorders. So that's one way to help it. Also, exercise is a really simple way to decrease your chances of illness because it reduces risk of type 2 diabetes, breast cancer, cardiovascular disease, stroke, and high blood pressure. All of these things that can just simply be helped by just exercising a few times a week. But some things that you can't change are your genetics. If you're just genetically disposed to have a certain type of illness like heart disease or type 2 diabetes or anything like that, you just might you can do as many preventative steps as you possibly can do, but it may just not be enough. Age also is significant. The older you are, the more sick you tend to get. The less your bones can withstand exercise, the less you're. It's just you get sicker once you get older. Race and gender are also non-modifiable risk factors. Women are more likely to develop cardiovascular disease. 1/3 develop osteoporosis, respiratory disease, and eating disorders. And so women have higher overall reported rates in physical and mental illness. It is more and that's because it's more socially acceptable for women to report being ill. A false myth in our society is that women have more time to be sick, which is just simply untrue. And women's roles are more stressful. They usually are doing multiple things. And so therefore they may not be taking the best care of themselves. Women's reproductive system is more vulnerable to disturbance and disease because you are housing a life. It is more susceptible for illness. A lot of women, get gestational diabetes and all these other health factors that come along with pregnancy. So they are also at higher risk for those types of illnesses. But women do live longer than men, so the positive is that while they may get more sick, they're definitely better at taking care of it.
With diet, there are a few nutrition recommendations that women should follow. These being to eat more plant-based foods, to fulfill our micronutrients of vitamins and minerals, especially iron, vitamin D, calcium, folic acid, especially when pregnant, to eat the right types of lean proteins, such as turkey, chicken, fish, etc., to get fill of complex carbs and to limit simple carbs, to eat polyunsaturated fats, to eat regularly, and to eat breakfast in the morning. This also aligns with the dietary guidelines for Americans from 2010, in that to have a balance of calories with physical activity, to consume less salt, less cholesterol and trans fats, added sugars, and refined grains, to consume more foods with higher nutritional value, and to stay away from foods that are super processed and with ingredients that you can't pronounce, and eat low-fat dairy products. And both of these relate to 2020 goals, and that there's still a focus on limiting salt, cholesterol, added sugars, and trans fats, and to have a greater emphasis on variety for 2020. And finally, just to promote health overall and to reduce the risk of chronic diseases through consumption of a healthy diet and achievement of maintenance of healthy body weight.
More and more generations are growing up consuming more calories than ever before and exercising less. Today, 60% of women are overweight and 30% are obese. There are two things that women can control in terms of their weight, and that's diet and exercise. Eating healthier and following the physical activity guidelines for Americans are great places to start. According to the 2008 guidelines, children need 60 minutes or more of physical activity composed of moderate aerobics and muscle-building exercises 3 times a week. Adults should do about 150 minutes a week of moderate activity or 75 minutes of vigorous activity involving all major muscle groups for 2 or more days a week. There are also some things that women can't control, and those are called non-modifiable risk factors, and some include age. As women get older, muscle mass decreases along with metabolic rates, which makes it more difficult to lose weight or even keep the weight off. Genetics also play a big role in obesity or weight control. Our eating habits normally develop at home, and once we establish those, it can be difficult to change them. And if your parents are obese, then you're more likely to become obese. And biologically, we have a hard time controlling that or changing that. Socioeconomic status and location in terms of where you live, urban or rural settings, are also really difficult to change, so those are considered non-modifiable risk factors for obesity. Obesity also severely limits your daily life, and it comes with serious health consequences. Early puberty, dysfunctional uterine bleeding, infertility, and higher miscarriage rates are all effects of obesity. Musculoskeletal pain is also something that comes along with being obese, and it can also cause methods of contraception to be less effective for women, and people who are obese can experience more disconnect with happy relationships, and they can have a harder time with everything. So obesity is not something that should continue as a trend for women today.
Social media, peer pressure can influence the way teens and women see themselves. Their mental perception of what they look like can become distorted, leading them to engage in risky behaviors when they feel they don't measure up to the impossible goals set in front of them. Self-image issues can lead women towards eating disorders, drug, alcohol use, and addiction. In the United States alone, according to a survey done by National Association of Anorexia Nervosa and Associated Disorder, a study found out that 20 million women suffered from a clinically significant eating disorder at some time in their life, including anorexia nervosa, bulimia nervosa, binge eating disorders, or an eating disorder not otherwise specified. The study was done in 2010. Another study found that adolescent girls were more fearful of gaining weight than getting cancer, nuclear war, or losing their parents. According to the First Aid Program study, which was done in 2012, 90% of people with eating disorders were women between the ages of 12 and 25 years.